Hey, this is SJ coming back at you with another video. Um, I happened to Google, because I'm a Googler, I'm always Googling. I happened to Google how many countries have universal health care. Just out of curiosity, I was thinking about our health care. I was on my community, going through my community tabs, and I was reading one of the community tabs that I posted. And was talking about. I mentioned, United States doesn't have any universal health care. So out of curiosity, I typed in how many countries have universal health care, and I really found some interesting facts. Approximately 72 to 78 countries have universal healthcare systems, though the exact number varies depending on the definition of data source. These systems aims to ensure that all residents have access to health services without suffering financial hardship. Examples including Australia, Austria, Belgium, Canada, Denmark, France, Germany, Japan, and United Kingdom. We're the United Kingdom. I'm geographically challenged. Number of countries, while sources like Oyster HR cite 78 countries, others such as Disio Capitalist and Borg, I can't say that, list 73 or 72 countries respectively for 2024. That's really interesting. Coverage definition. Universal health coverage is defined by the World Health Organization as a state where everyone has access to a full range of health services from health promotion to disease prevention without financial difficulty. Examples: some countries with universal healthcare systems include Albania, Algeria, Argentina. Argentina. Hmm. Argentina. Isn't that interesting? Didn't Donald Trump just give them $40 billion? Didn't Donald Trump just give Argentina $40 billion? Some countries with universal healthcare systems. Hmm, isn't that something? He gave $40 billion to a country that has universal health care, has a universal healthcare system, but the United States doesn't. Hmm, that's interesting. Australia, Austria, Belgium, Bhutan, Brazil, Canada, China, Denmark, France. Yeah, I knew Denmark did. Germany, Israel, Italy, Japan, Netherlands. Japan is a real good country. Japan is a real good country. Did you know that Japan is one of the safest countries in the world? Did you guys know that? Japan is one of the safest countries in the world. So you can go to Japan and go for a walk at 3 o'clock in the morning. You probably nobody will bother you. Can't do that here in the United States. Netherlands, I knew the Netherlands did. New Zealand, Norway, Singapore, Sweden, and United Kingdom. Where United Kingdom at? Financing models. These systems can be financed through different models, such as a single payer system funded by taxes, like Canada and the UK, or social insurance systems where contributions are made through Social Security and mandatory insurance plans like Germany. Isn't that something? International. What I don't understand is why won't the United States study other countries or how they do their um, universal healthcare systems? Like, why don't they do their research and study other countries and see what other countries do to provide universal healthcare to their citizens? I got the answer to that. Greed. The United States is the only high income country that does not guarantee health coverage to all its citizens. Isn't that something? The United States is the only high income country that does not guarantee health coverage to all its citizens. Wow. Ain't that something? Ain't that something? As of 2025, 78 countries are considered, it's kind of blurry, to have universal healthcare systems that provide coverage to all or nearly all citizens. Most developed nations have some form of universal coverage. Ain't that something? Universal healthcare systems vary widely in how they are funded and administered, ranging from entirely tax funded systems to mandatory private insurance models. Examples of countries with universal health care: Argentina, Brazil, Canada, Chile, Colombia, Costa Rica, Cuba, Mexico, Peru. Ain't that something? Argentina. And he just dropped them $40 billion. But they have universal health care for their people. And the United States don't. Make it make sense. That's really sad. I just thought I would share some of that. I thought that was I thought that was really interesting. When I Googled that, that was some interesting information. That's really a shame that United States don't have a universal healthcare system for its citizens. And the only what do you guys hit sound off in the comment section what you guys think? What do you think are the reasons why the United States doesn't have a universal healthcare system? And the number one reason that pops up into my mind is greed. United States is greedy. Another reason, they don't they don't care nothing about their citizens. The United States cares nothing about its citizens, but I don't understand because United States citizens pay taxes? United States citizens pay taxes, right? So why wouldn't you care about your citizens when they're paying taxes? You want to take care of your taxpayers. That would only make sense. The more healthy, working, productive taxpayers that you have, the more money you have. Like people are working, like now, you know how they take out a portion of your check for Medicare and Social Security, right? Okay, why can't they take a portion out of your check to cover universal health coverage? They take a portion out. They did when I was working. Every check they took out Medicare, which is I don't understand why they make you pay for it again, because they take Medicare, and they take Social Security, and they take federal income taxes, state income taxes, and city income taxes out of your check. That's what they take out. Okay, now they taking that. Okay, they take out for Medicare, which you have to turn around and pay for it again, which doesn't make sense to me. Um, okay, so why can't they take out some money for a universal health insurance plan? Take a portion out of, if I was still working, I wouldn't have a problem with them taking money out for a universal to go towards a universal health care, because if there was they take a portion of someone people's check. out, take money out of people's check for a universal health care plan that would ensure that everybody will, if you need to go to the doctor or you need to go to the hospital, maybe have to pay a small copay. You go to the doctor under a universal health care system, you might have to pay a small copay. Or that copay will be based on your income, maybe like a sliding fee type situation will be based on what your income is. Your copay will be based on what your income is. So whatever your income is, that's what your copay will be. Same goes for medications. If you need any kind of medication, it would be on a sliding fee type system where um, you would what you pay for your meds would be based on your income, whatever your income is. Okay, and then when you get your check, or when you're working, all like you're working and you have a job, like they take out for Social Security and Medicare, and taxes and that. Why can't they take out a little bit of money for a universal healthcare system? So when people need to go when you need to go to the doctor, insurance premiums are getting ready to skyrocket. A lot of people are saying they are going to go without health insurance because they're not going to be able to afford the premiums, because they're saying that healthcare premiums are about to go up and they're about to be higher than a mortgage or rent. That don't make no sense. So people are talking about coming on TikTok are talking about going without health insurance. They figure I might as well pay out of pocket for that. Or you might have to forego paying a healthcare premium and just maybe get a hospitalization, pay like a portion of your money towards a hospitalization plan, pay for all your doctor's appointments, and just pay hospitalization insurance just in case you got to go to the hospital. People are starting to think of other alternatives to pay. I remember I went 7 whole years without any health insurance because my job that I was working at the time didn't offer it, or if they did offer it, the premiums were too high and I could not afford it. That was the case on my last job. They offered insurance because they were a small company, it wasn't. It was kind of crappy, and the I think the deductible was too high. I think that's what the problem was. You had to meet a certain amount of money, and it didn't make any sense to me. And I'm like, I can't afford this. And I remember at the time being very upset that I couldn't afford that. And so people shouldn't have to choose between. It's really sad that people have to choose between paying your rent, feeding your family and your bills, and health insurance. People should not have to make choices like that, especially if you already have pre-existing conditions. Some people already have pre-existing conditions where they have to get medication on a regular basis. Like I have a underactive thyroid, and I have to get, although my thyroid medication is not that much, but it's just the principle of the thing. When I didn't have health insurance, I had to still buy it. I had to pay for it out of pocket. And because I still needed it. And so that's what I'm saying. It doesn't make any sense. Like when I was working my last job, and I had to um, pay for that medication out of pocket because I had no insurance, had no choice. You know what I mean? So that's what I'm saying. If you got a pre-existing condition, if there was a universal health care system in place here in the United States, and you have a pre-existing health condition like diabetes or something like that, where you need to take medication on a regular base, based on your income on a sliding fee scale, you can get that medication like that, on that sliding fee scale, and have to pay a small copay. Same with your doctor's appointments. You would have to pay a small copay based on your income, And then everybody gets a portion, a percentage of their check taken out to fund the universal health care system. You see how that works? I'm not even the president of the United States, and I know that. Okay? I'm not even the president of the United States. How come Donald Trump don't implement something like that? Why won't I mean, let me know in the comment section what you guys think about that. I think it's a good idea. I mean, if I was still working, I wouldn't care if a portion of my check goes towards universal health care, especially since I know I'm going to be covered. If I have to go to the doctor or the hospital, I know I'm going to be covered. I just have to pay my little pay and I'm good. That sounds like a winner to me. And then we should have, when once people turn to the age, once people at 65 and up, or retirement age, which they've moved it up to 67. They moved the retirement age up to 67. That's because they don't want you to collect your Social Security check. You know, they figure you'll kick the bucket before you get a chance to collect your Social Security. Greedy, 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 very greedy country. They moved the retirement age up to 67. Okay, so 67 and up, free health care coverage. Should be free health care coverage for people that are 67 and up. So if you're an elderly person, you should not have to worry about, an elderly person should not have to worry about how they're going to pay, because as we get older, we, we will have probably going to the doctor more, most likely 9 times out of 10, because as you get older, things naturally are going to happen the more older that we get. And you might need to go to the doctor more. You might need to go to the hospital more. You know, the older we get. Okay. So 67 and up, by 67 being a retirement age, 67 and up, free health care. Children should have free health care. Everybody under the age of 18, health care should be free. I think it mostly is. But I wonder for president, just cut Medicaid for low income children. So not sure it's not so sure it's gonna be free for children. But children, I remember they had this program here in Michigan. If you made too much money to qualify for Medicaid for your kids, because they would always give my kids Medicaid, but wouldn't give it to me when I was working. But and then at one time, I was making so much money that I didn't qualify. My kids didn't qualify for Medicaid, but they had this program. I can't remember the name of it, where you only paid $5 a month. You only pay $5 a month, and they will cover your children if you didn't qualify for Medicaid. So that was a good program. I don't know if they still have that in place. So, but everybody under the age of 18 should have free health care. 18 and up, you'll be covered under the universal health care plan, and you got a job and you're working. A portion of your check will go towards, it's like they take off of Social Security, Medicare, taxes, and all that. Okay, they take a percentage of your check to fund the universal health care system. You see how that works? I'm not even the president of the United States, and I know that. I'm not even the president of the United States. It's a good idea. Let me know in the conversation you guys think that's a good idea. That's a good idea. But I think it's really sad that the United States doesn't have a universal health care system. That's really sad. It speaks volumes. This is supposed to be the richest country in the world. This is supposed to be the greatest country in the world, which is a myth. It's not. This is not the greatest country in the world. This is supposed to be the richest country in the world. But why doesn't the richest country in the world and the greatest country in the world, which is a myth, have a universal health care system in place? Obama attempted it. And then people want to talk junk about Obama, but at least Obama tried. At least Obama tried. You can talk trash about Obama all you want, but at least Obama cared enough to try. He was the only president that cared enough to try. The rest of these presidents never tried. But I just explained how they can do that. And that idiot president that we have in there now don't give a hoot about nobody. He doesn't care. And his administration doesn't care. That whole administration doesn't care, and Congress doesn't care. Because if they did, they would be trying to figure out, instead of cutting health care, instead of health insurance premiums going through the roof, and them cutting health care, Medicaid, they would be trying to put a universal health care system into place. I just explained how they can do it. And I'm not even the president of the United States. I don't even work up there. Why hasn't the United States figured this out? We're going into the year 2026. And they treat healthcare like it's a luxury. That only the rich can access. But if your citizens, your taxpayers, the middle class cannot afford health insurance, your taxpayers, how many people are we going to lose? How many taxpayers are you going to lose? When you think about it, it makes sense. You want to take care of your taxpayers. You want to make sure your taxpayers are healthy. Right? It only makes sense. When you look at it, that's looking at it from a business perspective. Isn't Donald Trump supposed to be a businessman? Isn't that looking at it from a business perspective? Let's take moral out of it for a minute and look at it from a business perspective. Okay, you got your taxpayers. Don't you want your taxpayers to be healthy so they can continue to work and pay their taxes? Which means more tax money. Just like it doesn't make sense to not have free college education in this country. That don't make no sense either, because the more educated your workforce is, the more taxpayers you're gonna have. The more educated that your workforce is, the more taxpayers that you have. So that it would only make sense to provide a free college education, because it's not free. It's not free. It's discounted if you qualify for Pell Grants and other grants. But with Donald Trump eliminating the Department of Education, I don't even know if they're going to have that anymore. But it sure is not free, because we got the national student loan debt is higher than the credit card debts here in the United States. So it's not free here in the United States. College costs are through the roof. Some people can't even afford to go to college. Either college or trade school. Free college or free trade school, where people can learn a trade. The more educated your workforce is, the more taxpayers that you have. So it makes sense when you look at things from a business perspective. He's supposed to be a businessman. When you look at things from a business perspective, it makes sense. You want to take care of your taxpayers. You want your taxpayers to be healthy. The more healthier your taxpayers are, why would you want your taxpayers to die off? Why would you want them to die off? Make it make sense. Make it make sense. Hit me up in the comment section. Let me know what you guys think. Let me know what you guys think about what I said. About the United States having this universal health care system. What do you think about rising insurance premiums, and a large percentage of people in the United States under Donald Trump's administration is going to be going without health insurance? That's a really, really, when you got 78 countries that have a universal health care system and the United States doesn't, and this is supposed to be the greatest country and the richest country in the world. No, this is turning into a third world country. That's what it's turning into. Other countries are looking at the United States like, and that's why I don't know why people are breaking their neck to get here, to live here. They need to be breaking their neck going to another country. So let me know in the comment section what you guys think. Okay, hit that like and that share. Please hit the like button because that'll push up the algorithm. Let me know in the comment section you think that's a good idea, what I said. Take a portion out of people's checks to fund the universal health care system. And then when you have to go to the doctor, the hospital, your fee will be based on a sliding fee based on your income. Let me know if you think that's a good idea. Okay, hit that like and that share. And until the next video, you guys be blessed.